right, in more health, the newest trend in Hollywood is a dangerous one because more and more celebrities are sharing their struggles with mental health issues. People magazine recently profiled 31 different celebrities who have actually spoke publicly against their struggles, from James Franco battling depression, to Kendall Jenner and Emma Stone revealing their struggles with anxiety, to Chrissy Teigen sharing her story of postpartum depression. We've also seen some celebrities recently who have committed suicide, like Chester Bennington from Lincoln Park. So joining us now to talk more about it is psychotherapist Patrick Scott. Patrick, thanks for joining us. Yeah, this is a tough topic. In fact, one of those 31 celebrities is Jonathan Lipnicki from The Cute Kid from Jerry Maguire. I interviewed him many years later, and I felt it was one of the more awkward interviews I've ever had. Well, it comes out that he is one of these that has really suffered since his childhood days of acting.
There's a myth that somehow celebrities are larger than life, and we see them in the spotlight. They're on, they're smiling. I watched the piece earlier about Vegas as the red carpet headquarters lately, and it's really great. And celebrities, we have to remember, are human. They have good days, they have bad days. I would imagine, just like everyone else, they don't feel like being on all the time. And because they're human, they struggle with mental health issues just like the rest of us. They're just people.
Is it good that they come out and tell the rest of the world, or is it a bad thing?
I think it's good.
Okay.
I actually think it's a great thing because it does show, as you said before, they're just like us. They have struggles, we have relationship challenges, they have ups and downs, they have mental illness, challenges with substance abuse. In the last 5 years alone, we've seen a lot of celebrity deaths, some to suicide, some to overdose, and so on. So I think it's excellent because it shows us normal, mortal people out here that people, no matter how much money you have and how much fame and fortune you have, you still struggle from time to time with mental health issues.
You know, I was mentioning during the commercial, you have that whole segment in Us Weekly where they talk about stars, celebrities, they're just like us, and but usually they're pumping gas or walking their baby, but this really is something that we can relate to.
Absolutely.
Yeah. So what are some of the signs for us regular folks?
Yeah. So this is for us and for someone you know. So if something's off. Now, everyone has bad days. There is also a myth that somehow we're supposed to be happy all the time, and I don't think, in my experience as a therapist, that is realistic. Yeah. We have good days, we have bad days. If more than 2 weeks go by, or months, or years, and something's off, you're not right, you're isolating, you're withdrawing, you're not enjoying things that you used to enjoy, you find yourself more solitary and more isolated, then something's off, and I think it's time to pay attention to that.
Okay.
Second thing would be self-medicating. Now, self-medicating here in Las Vegas is an industry, right? Yeah. And we talk certainly more than drugs and alcohol. We talk about gambling, we talk about food, we talk about sugar or chocolate or anything where you're feeling uncomfortable in your skin, you're not so connected with others, and there's a desire to numb those feelings. Yeah. And whatever your poison of choice is, you notice an increase in a proclivity to self-medicate. Okay,
and of course also irritability, we all know that one, but what are some of the tips that people
I think the first thing is to ask for feedback. Ask your loved ones, your friends, if everything seems okay, if you seem like you're off, and get some feedback. Okay. Second thing is to go inside and actually assess and self-evaluate the quality of your life. How are you doing? How are you feeling from day to day? Yeah. And then, of course, the third thing is to get help. If it's been weeks and months that you've been off, find a therapist. There's great therapists out there, and I'd recommend that rather than finding a psychiatrist some people think, oh, I just need a medicine, I need a pill right away. Start with a therapist and then move there on to medication if necessary.
Dr. Scott, great stuff. I feel better already.
I'm sorry.
Thank you.
Pleasure.
Okay, guys, over to you.